Tell me about yourself. I'm Dhea, graduate from nursing major in Erlangga University in 2015. I have been working at a Dr. Sutomo hospital for 2 years as a nurse and enjoying every second of it. I'm a person who loves challenges because every time I have those in need, it has different challenge. What do you know about our institution? AGN provide cardiology and cardiothoracic surgery services for both adult and pediatric cases. As the National Referral Center for Cardiovascular Disease, AGN sees new cases referred from all over the country and even as well as follow-up cases at the outpatient clinic. One of the advantages of AGN is that there are quite a lot of facilities and medical staff available. The number of patient beds for critical care reached 106 units out of a total of 461 units. Then the number of AGN staff reached 1,865 people, who help 96 permanent doctor work. Why did you decide on the career of a nurse? I come from a medical family. My cousin is dentist and 8 people in my family are nurses. We discuss health often, so it kept me motivated to become a nurse. I am so proud if I can help those who need me, not only to recover from their illness but also their psychological state. In addition, being a nurse is also beneficial to my own life in various things. I always apply the government advice, which is a clean and healthy lifestyle in everyday life. Tell me what you feel your greatest skill as a nursing is. I have the ability to make patients feel trustworthy and comfortable because in providing nursing care, cooperation is needed between nurses and patient. If the patient doesn't feel believe in me, then the result will not be optimal. How do you handle the stress of the job? I find the best way to handle the stress of the job to make daily, weekly, and annual agenda based on priorities. In doing so, my work will be more structured and I will not lose my focus on the more priorities activities. I also have to enjoy working so that I don't put pressure on myself. What do you find is the hardest part about being a nurse? I think the hard thing I have had to deal with is to explain to the patient family that what we could do as much as possible to help patients recover from their illness, but more than that was God's will. Why do you want to work here? I'm fascinated in treating cardiac patients. For 2 years, I worked in the cardiac department. Your hospital is the largest cardiac hospital in Malaysia and in the Asia Pacific. Not only to help cardiac patients, but to provide care services for cardiac disease ranging from adult to children. So I'm excited by the possibility of being a part of that and learning from your expert. Are you comfortable working with other doctors and nurses? I have good teamwork skills because in the care of nursing, not all I can do myself. Some need collaboration with other nurses or doctors. Teamwork provides a good solution if a problem and is able to improve the ability to work. Example, giving antibiotic require collaboration with a doctor. Describe a time you had to deal with a difficult patient and how you handled it. Working with persons who still believe in the myths that exist in their society. If there is person like that, first we stand to the myth that they believe. As for me, I will straighten it out. At the time, there were persons with cardiac disease who believed in the myth that low-fat food were good for preventing heart disease. So this person only focused on low-fat food, not paying attention to other food. So I explained to patient, A diet low in fat and cholesterol is a must-have to prevent cardiac problems. But you also have to consume fruit, vegetable, and good protein to get the vitamin and mineral needed for cardiac health. Preventing is good, but being proactive will benefit more. I try to be a good listener from them and provide feedbacks in my field. Where should we hear you? I heard this disposition requires someone who has experience in the cardiac department. With that experience, I'm quite competent at this position. I'm a dog person and don't like to delay work. So I think I will be easy to adjust to this hospital.